Hey, Dr. McCann here, and welcome to Razor Rundown, the gynecologist guide to personal grooming. In this video, I'm going to answer the question that every woman has. What is the best way to get rid of pubic hair? To answer this question, we need to look at what we do in the operating room to get rid of hair before surgery while not getting an infection. So, infection protocol recommends that hair is removed only if it's in the way of the surgery and only by electric clippers, not razors. And why is this? The skin has what's called normal flora, or up to 1,000 different bacteria that normally live on the skin every day and don't cause any problems. The pubic area has an even higher number of these bacteria than, say, the legs do, for several reasons. First of all, because it's what we call an occluded area, or it's touching other areas. It has a higher body temperature and it has more moisture. Bacteria love all three of those things, and so different and more bacteria grow in the pubic area. So shaving can cause what we call micro injuries or micro cuts in the skin, little tiny cuts that you actually can't see. When the skin has little tiny cuts in it, this increases the chances that bacteria that normally live on the skin and don't cause problems get underneath the skin and cause skin infections, or specifically folliculitis, infection of the hair follicles. In contrast to razors causing these little cuts on the skin, electric clippers don't cause cuts, and so the risk of infection is decreased. So I used to have to recommend for women to get like a male's electric clipper to shave the pubic area, but now there are multiple options that are made for women specifically for this area. You don't have to spend hundreds of dollars on a medical grade electric clipper. Again, companies are now making electric clippers from women, specifically for the pubic area, that are great to use. So to recap, electric clippers are recommended for getting rid of pubic hair, and razors are not. However, if you are still going to use a razor, I do have a few tips for that, including making sure that you use a single blade razor only. Don't use one of these that has 3 or 5 blades that you would normally use on your legs. Single blade only. And if you use this, you're going to do one pass, one razor, meaning after you do one pass in the area, you're going to throw it away and you're not going to use that razor again. So if you're going to shave, single blade, one pass, one time only. That will decrease the chance of getting an infection over the 3 and the 5 blade razors, because again, what happens with these multiple blade razors is the first blade will cause little micro cuts in the skin, and the second and third blade will cause more cuts and introduce bacteria into that area, significantly increasing your risk of an infection. Also, it's important to never share razors. Sharing razors can transmit viruses. So after you are done with your razor, if you use it in the pubic area, throw it away. If you choose to wax, you want to go ahead and make sure that you go to a reliable facility that changes the wax out after every use and sterilizes the container. The pubic area is very sensitive, so if you are not used to waxing, you might want to try it on a small place on your arm or your leg first to make sure that your skin is not going to have a reaction to the wax.